afternoon. My name is Sheena Moore, and I have been a nurse for 7 years now. Today I am here to talk a little bit about my history with nursing and some of the things I've done, as well as talk about my thoughts on the future of healthcare, ethics, and that sort of stuff. So to start out, I went to Oregon Health Sciences University 7 years ago now. I got my bachelor's there. And I worked at a hospital in Coeur d'Alene on a surgical floor for a couple years, and then I moved on to the VA, and I've been working there for the last 4.5, 5 years in primary care. And I really enjoy that. I've learned a lot about chronic disease, and it's really made me want to pursue learning more and getting more educated in that regards. I was fortunate this last year to do a medical mission trip to Cameroon. I spent 2 weeks there and got to see almost 5,000 patients. That's how many we treated, whether it be for medical, dental, or vision issues. I learned a lot about the world and health in general on this trip, and a lot about ethics. I saw some stuff that to me wasn't ethical. For example, I had long lines of these people wanting to be seen by us, and if the government officials, so to say, would come in with extended family, there could be 20 of them, and they would cut right to the front of the line of these people who had been waiting in line. To me, that wasn't ethical, but I was not in a place to say something. And so I learned, it was just an interesting experience altogether, learning about a whole different culture, and one in the developing world in which healthcare is very limited. And so a lot of my experiences since then have kind of changed, because I look at people now a little bit differently. I see someone who's struggling and you just don't know their story. So why should you judge them, or why should you wonder or think that you are more right than they are? So I really am glad that I got to have that experience. And so some of the pictures you'll see throughout this video are of my experiences from that trip. Nursing to me is giving the best care that you can give in a appropriate manner, educated manner, and with a lot of compassion and kindness behind it. One thing I like about the VA is that they've switched to a new model of care called PACT. Now, PACT stands for Patient Aligned Care Team. This is a model of care that really focuses on team and teamwork, and that the patient is at the center of the team. So the point behind it is that it takes everyone for a patient to have good experience with their care and how they feel and how they heal and get better. So I really think that is the way that healthcare is moving, and it's something that I strive to perfect. I'm very involved at work in making sure that patients get the appropriate care that they need by using all my resources that I have available. My 2-year-old little niece was over visiting a couple months ago, and she lives in Philadelphia, so I don't get to see her that often. But we were out walking around on my parents' property, and she got a little cut on her hand. Well, she was just, oh, my poor hand, complaining about it. And so I found a leaf, and I put it on her hand, and I wrapped it with some grass so that it would stay on, a little homemade bandage, and so her hand was all wrapped up. It actually looked kind of cute, and she was totally fine after that. And something so simple, and not even really a medical treatment, just the act of showing that I cared about her hand and that hoping that it felt better, doing this simple little task, was all that she needed. And so I take that example as as a meaning where no matter what you do with a patient, hopefully it's always a good experience, but no matter what happens, if you do it with kindness and compassion, that's what makes the biggest difference in that patient's experience. In closing, I'd like to thank you for watching my video, and I hope I had some words of wisdom for you. Have a nice rest of your day. Thanks.